One thing that I found quite amazing, Mr. Secretary, was the fact that you're currently commanding, based on the fiscal year 2025, an outlay of approximately $1.8 trillion, and Brazil's GDP is currently 1.9 trillion, almost the same amount. So you've been doing lots of reorganizing, reshuffling, and basically revolutionizing the intricacies of HHS. Based on that, what have you learned from being in government these 6 to 7 months at this point, balancing critique from the outside once you were back when you were an attorney and an activist, and now with real-world execution leading this department?
Well, it's a lot more fun being on the inside.
I'm sure it is.
But, you know, it's as you said, this is a huge job. It's the biggest agency in our government. We have twice the budget of the Pentagon. And we had, when I came in here, we had 82,000 employees. We downsized down to 62,000. During the Biden administration and the COVID pandemic, the budget of this agency went up by 38%. And so what we've been doing is scaling back. And, you know, what's curious is that the budget went way up, but the health of Americans actually got worse. So the money alone is not keeping people healthy. We need to really change the trajectory of this agency. And, you know, the American system of health is really a sick care system. There's at every level, from the doctors to the hospitals to the insurance companies, the pharmaceutical companies, people make money by keeping Americans sicker. And today we have the sickest population in the world. More than 60% of our kids have chronic disease. When my uncle was president, I was a 10-year-old boy. It was 3%.
We're talking about 1960 to 1963.
Around, yeah. And today it's gone up to 60%. So about 8 in 10 American kids cannot qualify for military service. We have obesity crises. We have diabetes crises. The autism rates in our population, in 1970, we had the largest epidemiological study ever performed, found that about 0.7, so less than 1 out of 10,000 Americans had autism. And today, the latest data from CDC, which is one of my agencies, is 1 in every 31 kids, 1 in about every 20 boys. In California, which has the best data collection of any state, we have probably the most accurate, so it's probably worse than this, is 1 in every 19 children has autism, 1 every 12.8 boys. And so we need to really change, we need to pivot at this agency and make it, and begin at every level, changing these perverse incentives which make people rich by keeping us safe, and align the economic incentives of our agency with good public health, so that people, so doctors, hospitals, insurers, all get wealthy by actually making people healthier.
Definitely. I mean, these perverse incentives, Mr. Secretary, that you just mentioned, they are very much prevalent in Brazil as well. And both of our countries have diplomatic ties for over 200 years. America was the first country to recognize Brazilian independence, which actually occurred in 1822, but recognized it in 1824. Other than that, we have so many cultural ties but one of them that's really alarming is the fact that even though Brazil and America, with all these similarities, being the 2 largest population-wise countries in the Americas, based on distinct industrial, military, cultural, and health policies throughout the last decades, we've gotten really sicker, considering the scenario you just described very accurately. I think I'm going to offering this interview that we delve into very specific subjects like the anxiety crisis you mentioned, obesity, the sedentary lifestyles. It's very much similar and mirrored by Brazilian society these days. But why do you think, you just basically gave us the diagnosis, but getting to the root causes, and right now, based on the fact that you're You have described this as the chance of your lifetime, the project of your lifetime. What are you doing to address these main, the root causes of all of these issues and these plagues?
Most of these diseases are linked to mitochondrial disorders. So there are environmental toxins, and really these are dietary diseases. Diabetes is clearly linked to diet. You can cure most diabetes. You can lose your diagnosis by changing your diet, by getting rid of processed
We're looking
foods.
at 19 million Brazilians who are diabetic.
Right, and it's it's the same reason that we're seeing this explosion of diabetes around the world. Brazilians are increasingly relying on processed food rather than fruits and vegetables and meats and proteins that were part of the traditional diet. 20 years ago, the diabetes rate in China was 0. And today, 51% of Chinese adults are either pre-diabetic or diabetic. And the reason for that is almost certainly partially because they built 20,000 fast food places in China. And they're importing more and more processed foods from Europe, but particularly from the United States. And it's not really food. It's food-like substances that are poisoning us. They're mass poisoning us. And, we need to reform our agricultural process, but also just our food system. The diabetes coming from ultra-processed foods, which are carbohydrates and sugars, different forms of sugars, which trigger the diabetes. And what we find is if people switch to a protein diet, that they can very, very quickly lose their diabetes or their pre-diabetes diagnosis. So, food is medicine. And the processed food seems very cheap when you buy it in the market, but it's not cheap over the long term.
Exactly. Precisely.
Because it's gonna make you sick. And whatever kind you eat, you're gonna be sicker.
100%. But if I might, Secretary Kennedy, based on the drug prices and what HHS under your command has been addressing and proposing specifically on the most favored nation drug pricing policy, I'm going to tell you a quick story here. Recently, a great friend of mine who's American, he's being treated for Crohn's disease. It's an inflammatory bowel disease, as you know. And he was stunned to find that he pays $3,000 a month for the medicine he's prescribed here in America. And once he was in Sao Paulo, Brazil, he paid simply $400 for the same exact medicine. Many Brazilians, and I would guess citizens of the whole world, are kind of worried that this could push drug companies to raise prices abroad. How are you looking at this particular policy right now?
Well, the United States basically pays for global pharmaceutical research.
Yep.
So U.S. citizens, we account for about 70% of the profits for the pharmaceutical industry. We're only 4.2% of the world's population. And the reason for that is that other countries simply won't pay for it. And so the drug companies sell to other nations to say, we're not going to pay for these more expensive prices. And what we've now told the drug companies is whatever the lowest price that you're paying in any other nation, that's what you're going to charge here. And there's ways that we can do that. The way that we can do this is that most of the drugs that are purchased in this country are purchased by Medicaid and Medicare. These are government programs, so we can tell the drug companies we're not going to pay anymore. But we also want them to lower the price for the private market. And we have other tools for getting them to do that. We're trying to get them to volunteer to do that. And
maybe you got to push a little further and a little stronger. Are you facing some sort of
it's not
resistance from big pharma particularly?
Well, of course. But it's not only the pharmaceutical companies, but the other countries have kind of gotten a free ride on the United States because they're getting the benefit of all of our research, and they ought to be paying their fair share. We spend about 8% of our GDP on drugs. And in Europe, they spend 3%. And so what we'd like to do is see them bring that up to maybe 6%.
And if I might even add to that, some estimates say U.S. consumers pay up to 300% more on drug prices than their European counterparts. I think that goes along the same lines that you were describing, right?
We spend a lot more. You can get Ozempic, for example, in this country. I think the list price is $1,300 a month. And in London, you can buy the exact same drug that's made in the same factory in New Jersey for $88 a month. And so President Trump has said this is something that has been bothering him a long time, and that we're not going to do it anymore.